Can red light therapy help with pimples and breakouts? Hi everyone, I'm Dr. Chen. Welcome back to the Loombox channel where I share science-backed information about red light therapy. Now today's topic is super close to my heart because I used to suffer with severe cystic acne requiring rounds of Roaccutane. It was a long and frustrating journey because a lot of the options I got was only treating the surface, lots of different creams and topical, and the acne just kept coming back until I took a more integrative approach and started looking at the root causes of my acne. So if you're experiencing acne, I know exactly how you feel. It can reach that point where you would do anything to stop the pimples coming and make the scarring less visible. Now, when it comes to acne, most people just focus on the skin. They use topical treatments and different creams, but we now know that acne can actually come from factors within our bodies, like our hormones, gut health, and it wasn't until I addressed these factors, like changing my diet, addressing my hormone imbalance, my gut health, alongside treatments like red light therapy and changing my skincare, that my skin started clearing. It's not just teenagers who have acne, that's a myth. 12% of women actually experience acne past the age of 25. So if that's you, you're certainly not alone, and I was there. In this video, I'll be sharing some studies on red light therapy and acne, but before we do that, let's talk about why we get pimples so we can address some of those root causes that I talked about. Number one, excess oil production in our pores. So this is known as sebum, and this is actually a good thing that protects our skin and builds a healthy skin barrier. But when there's too much of it, it can start to block our pores. Things that can trigger excess oil production from the glands in our skin are things like hormones, especially testosterone, high refined sugars in our diet, so things like donuts and sugary drinks, sodas, which trigger a high insulin level, which is why acne is often a symptom of a condition called PCOS, polycystic ovarian syndrome, where there's a lot of insulin in the body, and that in turn can trigger a high testosterone level. Other things like stress, poor sleep, and even our gut health can have an impact on our hormones and therefore oil production in the skin. The triggers are different for everyone, so work with your doctor. But for me personally, two things really triggered my acne: dairy and refined sugar. Number two, the buildup of dead skin cells in the pore. So it's actually normal as part of skin turnover to have dead skin cells that shed from our skin. But when there's too much going on, this can get mixed in with the excess sebum that I mentioned earlier, and the oil and dead skin cells together form a plug which blocks the pores. These are commonly seen as whiteheads, so the little bumps under the skin, or blackheads, often on the nose, the black little dots. And this leads me on to number three, bacteria growth in the pores. So once these pores are blocked by that plug, bacteria can start to cause inflammation. This produces a bump in the skin with swelling, redness, so that's often kind of seen as the inflammatory acne papule, and sometimes they can turn into cysts as well. Now, this doesn't just happen on our face, it can also happen on the chest and the back as well. Now, obviously, acne is super complex, and it will be impossible for me to cover everything in one short video. So you should work with your dermatologist to make sure that you have a protocol that suits your needs. But one trendy treatment you may have seen lately on the internet is red light therapy. Can it work? Now, I've spoken about the benefits of red light therapy in my other videos, and you can go and watch that after this one. And by the way, here's a reminder to like and subscribe to our channel for more science-backed information like this. But in short, red light has been shown to be helpful for things like inflammation of the skin and rejuvenation of damaged tissue by rebuilding collagen. But there's also some evidence that blue light could reduce the bacteria that causes acne. Personally, I'm not a huge fan of blue light because there's some preliminary evidence showing that it could contribute to skin aging by inducing oxidative stress. So it might cause problems down the line. Obviously, if you're being guided by a dermatologist, make sure to just follow their advice on how much and how often to use it. I personally prefer to use red light because that's been shown to be anti-inflammatory and anti-aging. Now, in this randomized, single-blinded, split-phase clinical trial, they assessed the effect of a portable red light therapy device made in Germany on the appearance of acne. In this study, there were 28 people, and the wavelength that they used was between 635 to 670 nanometers. So that's in the red range. They did a study for 8 weeks and they applied red light therapy to one side of the participant's face for 15 minutes twice a day, and they assessed them at intervals during the 8 weeks. So what I like about the study is that each of the participant was their own control, because they had one face that didn't receive any red light therapy, and on the other side they received red light therapy. So you can do that direct comparison very easily. What they did was they took clinical photos and also counted the number of lesions on each side of the face at 1, 2, 4, and 8 weeks. Their conclusion was that the percent improvement in non-inflammatory and inflammatory acne lesions counts on the treated side was significantly better than compared to the control side. And here are a couple of pictures from that study. And you can see that on the bottom, the two photos didn't show any change in acne because that was the side that didn't receive red light treatment. The top two pictures showed the treated side of the face, and you can really see some good results before and after treatment in just 8 weeks. Now, I don't know about you, but when I search red light therapy on the internet, my feed is full of wands and face masks, and it can be really difficult to know what device to get. And there are two important things to look for when you're looking for a red light therapy device. One is that the device has been third-party tested for irradiance, which is the power, the amount of light the device can give out. This is very important because without an adequate dose of light, it won't work. And number two is the wavelength. So in the study that I just shared, the wavelength they used was in the red range, around 650. And that's the wavelength most studies seem to be using to demonstrate a benefit. So you want to be looking for devices that emit wavelengths around 650, 660 nanometers at a good, adequate irradiance level. As I mentioned earlier, there are studies that use both red and blue because red is thought to reduce inflammation and help repair the skin and build collagen, whereas blue is thought to reduce the bacteria in the skin that can cause acne. Now, I'm not a huge fan of blue just because I'm in my 40s and I don't want blue light to be causing oxidative stress in my skin, which then can contribute to aging. So I'd rather use red, but obviously work with your doctor to see what's best for you. I know that no one wants to be wasting their time and money buying random red light therapy devices that have not even been tested for irradiance of wavelengths. So if you're interested in learning more about red light therapy, how to use it, how to look for the best device, we have a free resource for you in the caption below that can help you avoid some of the most common mistakes when it comes to using red light therapy. Thank you for watching. If you found this video helpful and you want to see more skincare content, give us a thumbs up and don't forget to subscribe for more tips.